Hi, Dominic. It's lovely to see you.
Good to see you too.
How are you?
I'm good. Looking forward to this wonderful gathering that you're organizing.
Mm, yeah, me too. I want to just introduce you a little bit. Dominic is the author of this amazing book. And if you are a doctor, particularly, but any healthcare worker, you'll get a lot of value out of having a look at it. And Dominic, you work at Notre Dame University in Indiana. And can you tell us a little bit about what you've been doing in your work with medical education and with the students, the med students?
Sure. So I'm a medical psychologist, and I've spent pretty much most of my career involved with the training of mainly physicians, but also nurses and other helping professionals in healthcare, especially, and then also my own clinical practice. In the last 14 years, I've been the director of the Hillebrand Center for Compassionate Care and Medicine at the University of Notre Dame. I'm involved in basically two types of activities. One part is working with healthcare organizations and residency programs and medical schools on integrating the science of compassion into their operations and their clinical practice and their well-being practices. That's one part. And the other part, especially here at Notre Dame, has been getting this information and this training to people earlier in their training. So now this differs depending on which country you're in, but one of the things that happens in the United States is that people um, would hope for this kind of training in medical school and residency, and we are piloting projects in residency programs and medical schools. But what happens is there's so much hitting them at that time. So what ends up happening is this gets relegated to the side. And so it's difficult to do. So I'm working with organizations and medical schools and residencies on doing this in the reality of that situation. But what we've started here is like, let's start before they enter medical school, before they go to residency, and let's give them the same information, the same training before they go in. So not only a kind of a sense of how do you do this with patients, but what do you do with your mind? What do you do with your heart beforehand? Because this is really difficult to do at the same time as you're being hit very hard with so much in medical school and residency or in clinical practice. It doesn't get easy to do anyway. But what's really exciting is that when people realize uh, how important compassion is, that it's not a soft thing, that's not a sentimentalistic thing, that it's actually very much the foundation of being an excellent healthcare clinician. When they realize that, it really energizes them to get into the work. And it help them keep balance more quickly.
Yeah.
So
I found that so useful when I was reading your book, How Doctors Care, how you were able to describe the sentimentalizing of compassion
yeah,
and to really draw out the science of compassion and to be looking at how healthcare professionals use emotional detachment as a survival skill.
yeah,
And, I write in my book about compartmentalization, and it has a place. It's really useful. I mean, we're looking for aren't we? We're looking for how can we have emotional detachment when we need it, perhaps in the short term, so
yes.
do the clinical work, and how can we also maintain our compassion, which is that human to human connection, the reason many people are in the work anyway in the first place, in the face of challenge, including trauma.
Yes. Oh, yes.
I wonder what you've learned about teaching compassion, Dom. What have you learned that's really important? And a little bit, we've only got this short conversation, but why is it important to teach compassion, or why is it important to teach compassion in the way that you are doing it?
Well, I think what you said lays that out very beautifully, because we all, for the most part, want to go into healthcare because we want to help other people. We want to make the world a better place. So that motivation to respond to suffering is what leads us into medicine. But then once we get in there, the suffering, first of all, can be overwhelming to us. And then there's so much of it. And then we're like, oh my gosh, how can I keep doing this? And then how do I keep doing this in systems that are dysfunctional or in difficult situations? How do I keep doing that? So the very thing that leads you into healthcare, the desire to help other people using the gifts that you have, ends up, you get to the point where it's like, well, I want to keep doing this, but this is so hard. I have to shut off my emotions in that process. So what I like, and I think we all learn how to, those of us in healthcare, we learn how to do this in a sporadic way, if we're lucky to run into good colleagues or people who have pieces, pearls that we can listen to. But what's really come together right now is that we're realizing that trying to do a detachment is actually, even though we understand why we think we need to do that for survival reasons, it's actually leads us into a path where we end up giving poorer care to patients, and we actually get ourselves in trouble with burnout. And that the key distinction between empathy and compassion, that compassion in terms of a brain state is different and actually holds the empathy. And that's what helps us keep doing the work. And even if we get exhausted, it actually becomes an energy source. So when you use the word compartmentalization, what's happened is I've been doing some research with ICU physicians and emergency room physicians on mental performance. So I asked them, how do you get yourself ready mentally to go to your shift? And once you're there, how do you stay sharp? How do you stay patient-centered? And once you're done, how do you recover? And we've gotten into this word compartmentalization. And I've had some very intense discussions, especially with ICU physicians, about compartmentalization. And so what's really come through in that is that compartmentalization is an image word. But we shouldn't do neuroscience with an image word. But the truth in that word is, as you get into this work, you learn how to emotionally regulate yourself in really difficult work. But it's actually not detachment. It's actually emotion regulation. And so what I remind people is that the brain is an electrical system. It's not like you can like shut off the emotional piece. But what happens over a period of years in doing this work and being with great colleagues and having good training, good information, is that you learn how to achieve a brain state where you can notice suffering, be moved by it, but not overwhelmed by it. And then learning how to use yourself emotionally, cognitively, use yourself as an instrument of healing and balancing that. So instead of in the training, what I'll say to people is, we're not going to train you to be emotionally detached. We're going to train you to be emotionally regulated. And one of the challenges is people will learn the definition of compassion. They'll learn the studies in it. But then it becomes like, okay, how do you help yourself learn how to recognize that in yourself and how to stay in that state ongoing for a longer period of time? So that's where wherever people are, whenever people are ready for this, is helping them get those distinctions. Because there is a reality that we feel detached or compartmentalized, but in the true compassionate sense, it's really not detachment. It's actually a full emotional engagement that's balanced.
Wow. Thank you for extending my thinking on this already. It's amazing. I know when in my work, people are always fascinated when they learn about the different neurological equipment that's engaged in empathy or
Yes.
compassion. I feel like I've been one of those annoying people that consistently says, please stop saying compassion fatigue. It's empathy fatigue. It's not compassion fatigue, compassion sustainable. And so I think, there's still some work to do around that. Healthcare is a big sector with a lot of people, so we need lots of conversations. What do you think it gets in the way of, this information and this learning kind of just running away like wildfire? Why is it that universities and employers of healthcare professionals, why is it that they are not investing a lot more, time, effort, energy, money into just getting this message out there? And I think it's
Yes.
supportive in the work that I do. People find this really supportive to learn what you're talking about. Why is it that it's not running away like wildfire everywhere in the health system so that we all understand this?
Because those of us who have been working with this information and this approach are finding amazing returns from that. And organizations that I've worked with, either as an outsider coming in or ones that have been inside, when we discover the power of this, scientifically speaking, it really works. It really makes our patient care better. We're actually better. We're actually buffered from burnout. We're happier in the work. And then the organizations are more successful and people want to stay. So in many ways, it's a simple solution. So why is it? Your question is so perfect. It's like we actually have the medicine. But I think what happens is the way we sentimentalize compassion, we make it sound like a soft thing. And so I've had physicians say, well, I'm not going to be very compassionate today because I got to challenge a patient about whatever. And I'm like, going, are you kidding me? That's the most compassionate thing you can do, is say to a person, I am so worried about you. I want to talk to you about this. That's really compassionate. Or when you talk to a researcher and the researcher says, well, we don't really do compassion here, we do science. And I'm like going, are you kidding me? Like, you are noticing a suffering, studying it, and if you find an answer, the impact will be huge. You as a researcher are actually quite in the compassionate work. But I think because we think it's not scientific or we think it's soft, and then the other thing is we get financialized. We start looking at ourselves as commodities. We look at our patients as commodities or objects, and that gets us in this downward spiral. But I think, for example, when I work with people and we start talking about hard science and soft science, so for example, the people I get to train, the students I train, I'll say to them, you are no longer allowed to use the word soft science. You can use the terms hard science or harder science, but you need to know that what we know now about compassion is that the hard sciences or the harder sciences, whichever you prefer, this is very solid. But when people start saying the soft skills or the soft science, what they've done is they've already handicapped themselves from the full potential of compassion science. So the first thing I try to do is help people realize it's very much like the wonderful telescopes we have now, like the James Webb and the Hubble telescope. It's like now we're discovering all these galaxies and all these astronomical amazing discoveries, but they were already out there, you know. What's happened is that we didn't make them happen. We had better instrumentation so that we could observe what's been there for millions of years. So with compassion, compassion is as old as being human. But now, because of this instrumentation, we're able to understand and appreciate who we really are. And I think in healthcare, we we want to respond to suffering and we want to get there as quickly as possible, and we're stressed and it's hard, and we're misunderstood. So it's easy to go, well, that's not really going to help me. That soft thing is not going to help me. But I think what happens, and I think this is what's exciting about being with you and the other people in this gathering, is that we realize that throughout the world, we're all rediscovering how crucial this is. And that in pockets throughout the world, uh, people are like going, this is worth investing in. This actually makes things better. Frankly, what I see in many organizations is they lose this and they realize like, wow, everything is worse. The clinicians are less happy, the patients aren't happy, and our business is spiraling down. And then they rediscover this ancient wisdom. And then we get back on track again. And I just see that over and over again.
Well, here's to more of us getting on track again, Dom. That's a very inspiring idea. I think before we run away in too much excitement, I want to just acknowledge that you do write in a disclaimer in your book that no matter how resilient or how well or how much compassion the clinicians develop and try and activate in their work, that if they're working in systems, healthcare systems, but also societies with unrealistic expectations that are making it impossible,
Yes.
we still have this struggle. And I think you're pointing to that this thing now in Australia, that commoditizing or the financial issue is definitely on the table. Resources are always a problem, but it's a bit different to the system in America, and it often shows itself in our public system with not enough people working in the public system, vacancies not being filled, and that puts pressure on resources. And so something I think happens is people are in survival mode, and it's very
Yes,
hard to generate something new when we get into survival mode. We
it
start to
is.
blame the system and say it's not me, it's the system, and then feel helpless and hopeless.
Yes.
And part of this, the intention of this gathering, the Heart of Medicine, is to try and bring people together, to uplift each other, to feel a sense of community, to feel connected to each other, to bring the hope that we all individually in this work carrying, that sometimes we lose, so that we can be together and at the heart of it, I guess, just really encourage each other that this work is making a difference and that there are other people doing the work. I don't want to put new words in your mouth, but what is it that's having you willing to travel to Australia and be with us for this event?
I think what you're saying, the truth of what we're all experiencing is that this is a very difficult time. And we don't like the way, for example, various systems are pushing us. And we don't like who we're becoming in it. And so there really is the temptation of, let me get out of this. But I think what a lot of us are experiencing, and I think this is what this gathering is about, is saying, yes, this is a terrible time, but there have been other terrible times in healthcare. And this is our terrible time. Who do I want to be in this terrible time? And so there is a way of like, it's very understandable that we would get discouraged, why we would want to leave. I know for myself, 30 some years ago, after doing research on and I discovered this link at that time, it wasn't a well-known one, but I discovered it with nurses and then later on with physicians, that some types of empathy were related to less burnout.
Mm.
And I was fascinated by that. And now we can articulate why that is. But the reason I'm saying that is that even though I did the research on that, Cherie, 5 years later, I went home and I said to my wife, I hate my patients.
Mm.
So I had gone from being this researcher on empathy and burnout and discovering this wonderful dynamic to going, I hate my patients. I'm just going through the motions now. And my wife said something really wise to me and very helpful at that time. And she said, well, honey, you've got a problem
Mm.
because the people who come to see you need you to love them. And so you've got to go back and figure that out so that you can do that again. And so that is what really inspired me. And that's what really started what ended up being the book was finding out, and this I think is the essence of this gathering that you're organizing, is that when you get back in touch with what do you really want to fight for, who do you want to be in the tough times, when you get back to that, there's something in our human spirit that corrects itself. And what I've noticed, no matter what theory people are using, what model they're using, what approach, is that just like when we have a fracture, when you have a bone and it fractures, we set the conditions for it to heal. But we don't do the healing, we're setting the conditions. What I find is that when people, like the people that you're gathering, when we get together in this amazing place, when we get back in touch and we set the conditions for this is who we are as human beings, this is who we want to be, and then we're with each other, there is something in our spirit that heals up and becomes re-energized. And I've seen this over and over again. And at first I thought it would be, like maybe with one theory or one approach. What I've discovered is all of us are getting at that core reality. And we may use different language, but when we get to that core, something comes on fire again, just like it did for me 30 years ago when I went, I don't want to be like this anymore. I don't want to become a curmudgeon, a detached person who is resentful. I don't want to be that way. Yes, it's hard, but I want to be the best I can be in this hard time. And I think that's what this compassion gathering is about, that you're encouraging us to share our wisdoms in this very ancient place. And I think that puts us on fire again. But that's what I've noticed over and over again. And I know you have, and the other people that you brought together with this, is all of us are noticing that when we work with healthcare people and we help them get back to the core of who they are and who they want to be, and they learn like, okay, all right, I think this is a pathway through. And I think that's what we're all doing. But it's a new path for all of us.
So beautifully said, Dom. I wish it wasn't a year away, but anyway, it is. And so hopefully many more people tap into this conversation over the next 12 months. And I know we're going to have a really uplifting, encouraging learning space together. That's much more than cerebral, that we can feel in our bodies as well, and that connection lasts, ripples out and lasts way, way past when we're physically together. So thank you for your time today, and thank you for being part of the faculty at the Heart of Medicine. I've learned so much already from you, and I know that that's going to keep continuing the synergy between us all. I think fire is the right word. It's fantastic. It's right, lighting lots of useful fires.
Well, thank you for doing this, but there is a sense of it's far away. But what I've already noticed in the conversations we're having is it's already working on us now. So I think the fact that we're registering now and we're getting interested, and I've already noticed in myself thinking differently because of the place and the spirit that you're giving this. I feel like it's already going to start working on us way before we arrive. So I just want to offer that as in gratitude for the way it's already giving us something to re-energize ourselves with and learn from.